Hey guys and welcome. So today I am here with our new little addition. Her name is Jujubee. She's a little micro chihuahua. She's just hit 1 pound, so she's so tiny. But thanks guys for watching and welcome back. So today I'm going to be talking about the actions that I took prior to doing my DIY FMT or do-it-yourself fecal matter transplant or fecal microbiota transplant, to be more specific. So doing a DIY FMT it's very scary. There are a lot of different things that you have to look into prior to doing it. Like, number one, is your donor tested or screened? Number two, like, is it going to cure the thing that I want it to cure? Has it been done before? And like, there's so many different things. So for me, it's more like the FMT has never been done to solve my issues, not that I know of. And I've done so much research looking for clinical trials, all this different kind of stuff. But it came down to rationale and where my issues were coming from that made me want to do it. So I have chronic idiopathic urticaria, or chronic hives. It has been going on for about 10 months, maybe 11 months now, and it is bad. And it is truly debilitating. Between the medications and the hives itself, it is like you are on bed rest, you don't want to wear clothes, you can't take warm showers, like so many different things. But in addition to that, my blood work came back saying my calcium is super high. I am on the verge of having an autoimmune disease. They don't know what kind. And that I am going to also, I have surgery planned in the next few weeks for a hemorrhoidectomy, which is a result of my chronic constipation. So I started seeing that the two are interrelated completely. So when I am able to release in the bathroom, it seems like my hives are worse that day. On the days that I'm not, it seems like my hives are a little bit better. Also, I know that when I stopped my probiotic, my hives got infinitely better, and my hives came on a couple months after my probiotic. So if the immune system, which is what my chronic idiopathic urticaria are functioning from, if the immune system is not reacting well, but the immune system functions from the gut, that made me lead to think that, okay, well, if it's a gut issue, it's not autoimmune, the main cause is truly the gut. So that's why I started getting on this wheel of all of these different gut issues. I started a no sugar diet and I saw progress with that with my hives, but then I relapsed. No sulfate diet, again, saw some progress, but relapsed. And lately my hives have been kind of hit or miss. They've been on and off. So some of the actions that I took prior, which I chose my donor based on the fact that I realized I was going to have to do more than one of them. So there's convenience and feasibility. The fact that you do need the stool collection and transplant pretty short after. So it's not like I could get it from my colleague and then go in and be like, okay, I'm just going to wait until I go home after work to do it because, I've got to wait. I'm there for 8 hours a day. So by the hours of 5 or 6, it kind of stops. So the things that I did do, because none of the doctors in my area were allowing me to do an FMT medically, I decided to take it into my own hands. So I did several different things. Number one, I put my boyfriend on a diet. I said, no probiotics, no kombucha, like, let's minus the sugar. We're eating clean whole foods, which is what we pretty much eat anyways, but I was a little bit more specific. So putting your donor on a specific diet, because whatever he put into his body, you're about to put into yours. So I also bought 2 kits from Flore and tested both of our stools. It comes back. Flore tests the gut for 1,000 different types of bacteria and will tell you which ones are out of whack. Then I also did this, I forget what it's called, but it's a colorectal cancer test or colorectal cancer screening. And I will include a picture somewhere in, whoops, it's opposite, over here. Of what that test was, as well as the Flore test. I'll do that as well. And in addition to that, I did the Tell Me Jen test. And if she wasn't sleeping, the Tell Me Jen test. And so this one is a saliva test. This just tests metabolism and predisposition to different diseases. So making sure that you get the proper stuff. Like, I know we also spoke to my boyfriend's doctor to see if he could be a candidate. Now, my boyfriend does have some issues, but again, you've got to look at feasibility of this thing too, because you got to do it more than once, and so and you want to keep it with the same donor for the most part. So we talked to his doctor, and his doctor kind of cleared him to do it, but my boyfriend does suffer from allergies. He does suffer from IBS. And so those two things did come to mind because the FMT has been known to cure some of those things. So transplanting his stuff into me could mean that I take on those properties. Now, I mean, if I'm choosing here between chronic hives, autoimmune disease, and constant or chronic constipation, I'm going to choose the IBS and the allergies over all of those. But I'm just hoping that it doesn't make them worse. So again, I'm doing the biohacking on myself. For everyone out there that does have chronic hives, I really hope this works. Chronic hives, autoimmune disease, or chronic constipation. I am doing this for the greater good of everyone. So guys, please like my videos. Please subscribe. It would mean so much to me. Like, I need your support. I've been working so hard through this for so long that I'm like really hoping that something works out. So if you guys liked this video, make sure to click the like button, the subscribe button, the notifications button. I will be following up with how to do an FMT at home, and as well as the outcome of my FMT 1, 2, and 3. So guys, keep your eyes out for those videos. Thank you guys so much for watching. I hope you guys have a wonderful day, and little Ruth hopes you have a wonderful day as well because she's still awake. She's so tiny.